We can start.
Okay. Very good afternoon to all. Today we are here for the webinar, September webinar of ISHA on evidence-based intervention approaches in learning disability. So I would like to introduce our speaker, Dr. Jayashree ma'am. We have got a very expert speaker today with us, and she is presently associate. She is Dr. Jayashree. She is very approachable faculty and always working towards the improvisation of the standards of speech and hearing professional in India. And she is associate professor, All India Institute of Speech and Hearing. And she is also a chairperson, Learning Disability Clinic Head, and Telecenter for Persons with Communication Disorders. And her specializations include aphasia, childhood communication disorders, learning disability, and autism spectrum disorders. Her articles have been published in various national and international journals. She is currently chairperson of Learning Disability Clinic Telecenter for Persons with Communication Disorders, but she has also headed Department of Speech Language Pathology, ISHA. She has headed Department of Prevention of Communication Disorders, and she has been chairperson of Autism Spectrum Disorders Unit, and she is also associated with Sarva Shiksha Abhiyan Karnataka and Rashtriya Bal Swasthya Karyakram, Ministry of Health and Family Welfare, Government of India. Welcome, ma'am. We have a wonderful speaker. We have a wonderful speaker with us. You all will enjoy the session and learn a lot today. She has very good knowledge to share with us. And moderator is myself, Ms. Mona Chuk. I'm an audiologist and speech language pathologist in Delhi. And our coordinator is Ms. Tanya, who is also an audiologist and speech language pathologist in New Delhi. So why we have chosen this topic is a good question. Like if you see the studies I have written about, there are so many studies which have been done at very different places, like in Bangalore, Mumbai and Kerala, which shows around 10 to 12% of school population have learning disability in any form or the other, or they can be from urban middle class slum or rural areas. And most of these kids were referred to them for their poor scholastic performance. And like if I say about the second study which was done at Mumbai, 2,225 children were referred for poor scholastic performance, and out of those 640 were diagnosed as a specific learning disability, which was about 1/4. So this topic could be a need of ours, that so many children are having learning disability, and sometimes it remains hidden disability because it is misdiagnosed as poor scholastic performance. So we should know about this learning disability, and then only we can work on the intervention of learning disability. So we have chosen this topic, evidence-based intervention approaches for learning disability. Now I will request Mr. Ravi. So he has some exciting announcement to make for you. Over to Mr. Ravi.
Good morning, everyone. Happy Teachers' Day to all of you. So there is an announcement from Team ISHA. E-certificates will be provided and will be provided to only those participants who will attend the entire session and fill the feedback form, which will be provided at the end of the session. Thank you so much. Over to you, Dr. Jayashree ma'am.
Thank you so much, and thank you. It was a wonderful introduction.
I guess the whole need of this program is very well put across by the organizers. First of all, I think I should heartfully thank the Delhi ISHA branch who invited me for this platform. Not just because there is a need for this topic, but also because I think there's a lot of interaction that needs to happen between professionals across the country being in the same field. So I think this is a very, very good initiative that you have taken up. I'm also aware of the other things that you are doing. I think all of you are doing a wonderful job. And I wish heartfully all the best to the Delhi ISHA branch. And if there's anything that you want to get connected with us, we're always available here. So just feel free to talk to us and discuss about your ventures that you're going to take up in future. I hope we will be useful to you in all ways to uphold our profession in the country and the globe. So thank you once again for inviting me. So I'm going to start my presentation shortly. So I'm just going to upload my PPT. Is it visible? Are the slides visible?
Yes, ma'am. Yes.
Okay. Okay, so yes, I think my introduction is already done. So the topic today is something very interesting and always very close to my heart. One reason is I, as a student, always wondered why we should, as SLPs, be dealing with learning disabilities. Okay, so I think it's over the years that we actually learned, how important this is for the profession to know about learning disabilities and their role in learning disabilities. I think a lot of us are still not clear why this learning disability thing is, into the field of speech language pathology or even speech and hearing. Okay, so in the due course, I think I'm also going to keep giving out a lot of reasons why SLPs have to be a part of this whole concept about learning disabilities. And I think the chat screens will be open. If there are any questions, I guess you can put it across, and maybe the coordinator or the moderator will take over. Or otherwise, maybe at the end of the session, we can have more questions. So I'm just going to continue with my presentation and answer to your questions at the end of it. Okay, so proceeding with this, I just have a very small example of one child with who's Tina, who's 10 years, who's bright in all the aspects, but actually when it comes to reading and writing, Tina finds butterflies in her stomach. So she just can't read like others in her class. And I'm sure when I'm talking about Tina, a lot of you are thinking about the movie Tare Zameen Par as well, right? Now, that was, I think, a breakthrough, which I always think that they made an immense effort through the film media to actually make people aware that there is a condition like this and they are needed to be understandable by all of us. Okay, because earlier, I think people always thought that when it comes to a child with learning disability, this child is only, acting, or the child is just trying to be very lazy. The child does not want to be reading and writing, and that's the reason. It's an escape mechanism for the child. That is the reason the child is just avoiding the school, right? But I think now all of us are aware that there is actually a condition called learning disability, and it is not something that the child is doing it deliberately, but the child actually has a problem which needs to be understood. So I think many times, if you actually observe these children with learning disability, technically also, these are the children who have very good IQ. Their intelligence quotient is good or probably above average also. Okay, but that's again, you can take it as an advantage or a disadvantage. But what happens there is this child actually understands how people are reacting to his or her problem. Okay, so the child can get very emotionally down because of these things. The child can become aloof. The child can develop a lot of complexes because of all these reasons, because it just understands that it's not able to do anything about its reading and writing, and people around it are not really understanding the problem. Okay, now this is what I was saying, that they could just be absolutely fine in everything, But when it just comes to going to school or opening a book or trying to read and write, you just see a lot of anxiety in them. So the moment, you know, they start feeling that somebody is understanding their problem, I think half their problem is solved. This is my experience. I think 50% of the time the problem is solved when they come to us and we say, yes, we know that you have a problem and we can try to help you out. Okay, so that's the reason I said that understanding the problem by professionals and conveying to the parents or the child with the learning disability is very, very important part of our profession. Okay, so that's the reason I gave that example. Now, I think all of us know technically when we say learning disabilities, it is something wherein you'll see that the child is normal in all aspects. Okay, but the child has a neurobiological disorder and it could affect any of the processes of understanding the spoken or the written language, and this will affect the child's ability to speak, listen, read, spell, reason, organize, and do any kind of math calculations. So if you actually see this whole thing, you know, you see that this is where our role comes into play. So it's a lot of professionals in the other fields, or maybe even some in our field, do not understand that actually learning disability, a major chunk of children with learning disability can have issues with spoken language. Okay, so it can either be at the level of comprehension of the complex aspects of cognition, or it can be at the level of production itself, or there can be a delay, or there can be a disorder. Okay, so this is very much true. If you actually see the statistics, around 80 to 90% of children with LD will have some form of a spoken language problem. Okay, so that's a huge number. That's what I'm trying to say. So there can be a lot of other children who do not have a spoken language problem. And of course, if they have to rule out, they have to come to a speech language pathologist. Okay, and that's the reason I said that when there is a population of learning disability, the whole population of learning disability is around 10% in the school, according to one of the studies done by Professor Rama in the Regional Institute of Education. It's a published article. So 10% means for every 100 you see that there are 10 children who are actually having learning disability. But within that learning disability, if you actually see 80 to 90% of them are the ones who are language-based learning disability. That means they have some form of spoken language problems. Okay, now who's going to take care of that? It's going to be the SLPs. So that's the reason I said that we have a major role to play when it comes to children with learning disabilities. So these must be all the terminologies that you have heard of. I'm not going to go into the details because I'm going to take a lot of time for intervention, but I'm just assuming that all of you are familiar with these terminologies. But if you still have some doubts, you can put it on the chat screen and we can answer some of them. So you must have heard about dyslexia, dyscalculia, non-verbal learning disorders, CAPDs. Okay, so ADHDs, you have dysgraphia. So ADHD is, if you see there's a question mark there. Earlier, ADHD and LD was put under the same category, but now if you see that the DSM also bifurcates ADHD from learning disability. So children with ADHD can have learning problems, but they're ideally not called as learning disability. Okay, so that's the reason there's a question mark there. And then you have dysgraphia, then you have language disorders. So these are the language-based learning disorders that I'm talking about. Okay, so so you must have heard about children with specific language impairment. If they're not treated properly, they can fall into a continuum of language-based learning disabilities. So this is exactly the category that I'm talking about. Okay, it's the specific language impairment, SLI. If not treated or if not identified, they can turn out to become having school problems, reading, writing problems. And these are the kids who are exactly called as language-based learning disorders. Okay, then you have auditory processing disorders, then you have sensory integration disorders, which are nothing but dyspraxia, and we also have visual perceptual and visual motor deficits in learning disabilities. So these are like, so you can just see when I'm putting this across, it's such a heterogeneous group. And that's what should come into our mind. Okay, learning disability cannot be a homogeneous group at all. And you can't, you know, apply the principles that you apply for one child to all the children with learning disabilities. So you could have a huge subcategories, and I'm sure there are many more subcategories into this. Okay, so that's why we don't believe in a universal plan for learning disability. We have to go case by case basis. identify their deficit areas, their strength areas, and start working on with them. So yes, so many times what happens is our remedial intervention should focus mainly on how the child can be successful in school and life. So if you see, I'm stressing on this aspect, you know, we are interested to get success in school and life. It's not only in school. So we don't want the child to be doing so well in the school that he's the topper or the rank holder and, you know, he can do nothing about it in the life. That's not the ultimate goal. You know, we want the child to come up in his life. We want to train him so much and in a necessary way such that his overall quality of life improves, and then he's definitely productive to the society. So that is what we have to keep in our mind. Okay, so the intention is not trying to make him read and write again and again, you know, in such a way that, you know, today he gets 10 out of 100 and tomorrow you're expecting him to get 100 out of 100. No, we don't have to do that. Everybody can't do that. Even normal children who do not have LD cannot be so perfect. So why you know, pressurize children with learning disability? Okay. So the other aspect that I'm going to be talking about is remedial intervention, where we as SLPs should be focusing on teaching language skills in such a way that it can have an impact on the core academic skills of reading, spelling, writing, maths, comprehension, and reasoning. So I said we are going to focus on core academic skills, but how are we going to do that? We're going to do that from our language processes. We are going to do that from the language training that we are going to take up, which in turn are going to improve these core academic skills. So everybody understands when I say reading and writing, they're nothing but a mere continuum for oral language skills. So you are going to strengthen oral language skills, so that is in turn going to strengthen their reading and writing skills. How are we going to do that? We're going to see that. So apart from all of these skills, you have to be working as an SLP in areas of writing, spelling, and comprehension in such a way that it is actually stimulating the metacognition. Okay, so when I say metacognition, it's not just cognition, which means you're just thinking, but how well you can use your thinking power to think over that. Okay, so it's a higher level skill that you're supposed to be doing. See, you must be knowing these skills like your problem solving, your reasoning ability, your logical thinking, and all of that. So now how are you going to, you know, use or apply all of that in the appropriate situation? Okay, and that's what is going to be your metacognition. So it should stimulate the child for metacognition. It should improve the child's organizational skills, the child's attention, and ultimately it should bring up the child's self-esteem. You have to boost up the child's self-esteem. This is what you have to remember. That's going to be your ultimate goal for the child. The child at the end of your therapy should not feel that coming to a speech language pathologist is a burden. Okay, or he starts feeling even more inferior. Okay, ultimately the goal has to be in such a way that the child, when he comes out of a speech language pathologist or a therapist room, he feels much more confident. He feels that he's himself. He feels that he can carry himself forward and just rule the world. Okay, that's how we have to prepare them for. So yes, these are some of the problems or the areas of concern that I would say that, you know, how the parents would look at it, how a teacher would look at it, and how speech language pathologists would look at it. And if you actually watch out, the perspectives are almost similar, okay, but thought of in a different way, okay, or put across to you in a different way, okay. So you might see a lot of parents complaining to you on poor school success, difficulties while reading or doing maths, or he's not at all motivated to go to school. Okay, he just wants to remain at home, and every day he's making reasons not to go to school. He has difficulties doing homework, he forgets things very easily, and he has difficulties doing independent work. Okay, self-esteem problems. Okay, so this is something that is always my concern, because I don't want any child with learning disability, whether, you know, their skill improves or not is not my concern. My concern is we have to, you know, counsel them in such a way that you're boosting up their self-esteem. Ultimately, that is what is going to help the child. Okay, so that's why I said understanding the problem is more enough, you know, more than enough than just working on the problem directly. So these children can often have problems with friendships. I told you this before also. These are the kids who actually have good IQ, and they understand that the friends around them or the environment around them are neglecting them or ignoring them because they're not very good in studies. So you'll often see that these children tend to remain away from having friends or mingling with a lot of people, or they just don't involve themselves in too much of social interaction and so on. So there could be concentration difficulties. That's what the parents will complain, and they lose and forget things. So there's a lot of memory issues that they complain, a lot of anxiety, fear, and you'll also see a reflection of all of this as behavioral problems. Okay, and coming back to the teachers, so the parents, so the concerns of the parents is what we understood, but the concerns from the teachers. So what happens? They say that they have a lot of problems with emerging reading skills itself. So when I say emerging reading skills, the first thing the teachers say is that he doesn't even know how to identify alphabets. So you have this child who's in 5th standard, so he's 10-year-old, and the teachers will tell you that he's not even in the 1st grade. Okay, which means he's not even able to do alphabet identification, he's not able to do alphabet productions, he's not able to recognize uppercase, lowercase letters. So that's what the teachers will tell you. So that's a very good idea that you're getting, that there's a large gap between what the child actually shows up as being very good in other activities but so poor in reading and writing. So though his CA is 10 years, his probably the working or the academic or the grade equivalency, grade age is almost coming to the 1st grade. So he's 5th grade, but the grade equivalency is 1st grade. So that's a big gap for the child. And the child persistently has reading and writing difficulties in spite of a lot of teaching by the teachers. They have difficulties a lot with reading comprehension, because this is what you need to expect from the teachers, okay? Because you can actually see that the child might be reading, but the child is not comprehending what they're reading. Ultimately, the goal of reading is always reading comprehension. If you don't understand what you're reading, then you're absolutely like not making any sense, right? So you just don't want the child to be fluent in reading, but you also want the child to understand how fluently he's reading. Okay, so they could have learning difficulties in maths, attention problems is what you see often. Difficulties with doing work more independently. So you always see that the teacher has to be besides the child, working along with the child all the time. So the child cannot be working independently. A lot of behavior and social problems are observed in the classroom. They have difficulties understanding instructions, problems with visual perception. So that's why, you would have seen that they always perceive 6 as 9 or 9 as 6, or PSQ and PSG. Okay, so these kind of visual perception problems are often seen. They have a lot of memory problems, forgetfulness, motor difficulties. So motor difficulties, when I say, I'm not talking about the gross motor difficulties that the teachers are mentioning, but they're talking more about motor coordination. Okay, you'll just see that the way they hold their pen or their pencil is just not appropriate. It looks like they lose out on the hold on the pen, the grip on the pen very easily, not because they have a motor weakness, but because they have more of a problem with respect to motor coordination. And a lot of teachers will tell you that these children have language difficulties. Okay, so when they say language difficulties, they're not talking about any particular language, but they're trying to tell you that when instructions are given out in the classroom, these children are not understanding the instructions. Okay, and they're not able to produce or answer according to what is expected from the questions. So what about speech language pathologists? So speech language pathologists, you will see that they find that there's a lot of delay in development. Inattentions are observed by speech language pathologists, hyperactivity, they have poor coordination, and there could be history of birth complications, which we get to know from the case history, and a lot of visual and auditory perceptual issues are often observed by speech language pathologists. Okay, now more than anything, so those were some of the perspectives of parents, teachers, and speech language pathologists, which I just gave you very briefly. There's a lot more things that we need to talk about in identification and assessment, but since the focus is not on that, I'm not going to talk much about it. But yes, all the more I would say that it is an important aspect to remember that LD is something which cannot be dealt just by SLP, just by a psychologist, or just by a special educator or a teacher. Okay, it has to be a multidisciplinary approach. Trust me, if one of them is working, only on the child, it is not going to benefit the child. So you will realize at the end of the day, the child is coming to you for therapy for so many, is coming only to an SLP for so many days, and the child is not improving. It will not. It's very difficult for the child to improve, because what happens to the other areas that needs to be worked with the child? You know, very simple. An SLP is working more on improving the language skills in the child, language processing skills in the child, the bottom up and the top down aspects. But who's going to work on cognition? Who's going to actually work on their, you know, fine motor grip? Who's going to work on their motor coordination? Okay, so you need an occupational therapist to work on that. You need a psychologist to work on that. You need a special educator to work on that. Give him a lot of curricular support services. Okay, so that is the reason I said that it definitely requires a teamwork. Okay, and don't think that it's an easy thing for an SLP just to take it up. So I think each one of us should respect our fellow professionals and remember that we can work only with a team. Okay, LD is such a problem. It is a problem which is not unitary. That's what I'm trying to say. Okay, it cannot be handled just by a, you know, speech language pathologist. Like, for example, you know, when you have a condition like phonological disorder, you know, it's the SLPs who can help. You know, if there's a child who comes with cleft lip palate and you have to do their speech corrections, you know, it is the SLPs who can do it. It's more unitary. But when it comes to LD, it's not like that. It's a wider perspective. A lot of areas are affected, and a lot of areas which, you know, which we have to admit as SLPs cannot handle independently. We have to do it with the team. That's the reason I put across this slide. I think it is self-explanatory, so I'm not going to go into the details of this. So language-based assessment, very briefly, I'm going to tell you about this. See, whenever you do a protocol, an assessment protocol for LD, always remember in your mind that you as an SLP are more interested to know whether the child has speech language problems. Suppose there is a child with LD, suspected LD, who comes to you and you know that the child is coming out clinically normal on speech language skills. It's my sincere suggestion and request that please do not work with that child. They don't require an SLP to be working on. Okay, it's somebody else. So you just explore the areas, you know, which are affected, because you want to refer them to the right professionals. So it's very unethical for us to actually pick up a child who actually is clinically normal from speech language perspective, and you're still sitting and working like a teacher with the child. That's not your job. So please don't do that. Okay. But when a child comes to you, it is important for you to screen out for speech language skills or to assess them on speech language skills, just to make sure that, you know, that's not the area, you know, that the child probably requires help or not. If it requires, then an SLP will chip in. Okay, so what are those areas? You're going to check the child's general language performance, both in terms of receptive, expressive, for you know, listening, oral as well as written language. Now, that's the reason why I'm sure a lot of you are familiar that in ISHA, the protocol that we follow is when it comes to assessing for reading skills, we use the test for early reading skills. Okay, and along with that, we use a language battery. Okay, so a language battery which will tell you the oral language performance of the child. Apart from that, you should also be checking for the articulation, phonology, because a lot of times we have seen that children who have just come to us with phonological disorder actually have reading and writing issues also. And there's a very high correlation that is seen even in the research, okay, even in literature, because it's more to do with the way the child has encoded the phonological aspects, represented them, and the child is using that in his reading and writing skills, where he's making a lot of errors. And that's where we see these kids with phonological dyslexia. That's yet another subgroup of learning disability. Then you have to look out for morphology, syntax, pragmatics, as well as phonological awareness skills. This is just a protocol. I'm just leaving out some of these notes for you. I'm not going to go into the details. But what I would just like to tell you that these are some of the areas that we would want to work as speech language pathologists, okay, right from, you know, working on their academic skills and trying to improve their study skills, and then improving their cognitive skills as well as their language ability. So these are the language sub-functions that we want to take up, okay, right from phonological analysis. Okay, so you're working right from phonological skills. That's what I'm trying to tell you. Okay, so it is possible that a child with learning disability can have weakness at phonological perception. So that's the reason that you have to improve their phonological skills. That's why I said that literature or research strongly tells us that because, in phonological disorders, a lot of them have a poor representation of the phonological system of a particular language that gets reflected on their reading, writing skills also. Okay, so their phonological perception itself might be affected. So that's the reason you want to work on their phonological skills. Okay, definitely, if you find out if they have a problem, you're going to work on that. That's how it's going to be. And then you're going to focus on the semantics and the vocabulary, okay, skills, because a lot of these children with learning disability actually have a very scanty vocabulary. Okay, that means it's very restricted. The vocabulary is very restricted. You can ask a very simple question when a child comes to your OPD. You can just ask them, what did you do yesterday? So when you ask them, what did you do yesterday? The child is actually supposed to narrate the whole thing from what happened in the morning till the evening. So the child might just say, school, homework, TV. Okay, this is how they say, as against what a normal child would say, things like when I got up, I got dressed up, then I had my breakfast, then I went to school, then we had these many classes, and then I enjoyed a lot. We had sports today, so I came back home, and then I watched television for some time. I had my dinner, and then I slept. Okay, so there's so much that a child can say. I'm talking about, say, for example, a child who's in the 5th grade. Okay, so you will see that these kids actually have a very scanty vocabulary, very restricted vocabulary, and a lot of them can have lexical disorders. So when I say lexical disorders, it can be anything, right, from selecting the appropriate word from the lexicon. Okay, you will see that they can't recall some of the words as quickly as the other children would do. So in turn, they either don't say that word at all, or they would substitute that word with another word. Okay, so this is what you would see a lot of times as semantic issues. So semantics and vocabulary have to be improved by us. Okay, and then you have syntax and morphology that you have to be working on. So a lot of these children, even though they might clear out on your semantic section in most of the language tests, it's not that children with LD will not have problems with semantics. They can have problem with semantics. They can have problem with phonology. But most predominantly, you will see that because they have problem phonology, semantics, it is absolute reflection of that on their syntax and morphology. So you will see that they are, not very affirmed with tense markers, plural markers, or gender markers. They have a lot of problem understanding the grammatical relations, and especially when it comes to complex sentences. Okay, and the same thing is reflected in their productions also. So remember, these are the kids who are not understanding and also not able to produce. Okay, so generally you will see that these are the kids who just answer to you in word, and that's what you have to observe. We are not interested to know whether the child is answering it in word correctly, but we are actually analyzing the sentence also. We should not be stopping at that. So when I ask a child, something like, what did you do yesterday? And the child is just answering, things like school, homework, TV, you as an SLP cannot be sufficed with that. Okay, you have to try and find out whether the child can actually do it in sentence. And you will definitely realize that it's very, very hard for the child to do it in sentence. Actually, when you ask the parents, does the child have any problem in oral language? The parents will say, no, he speaks well. But actually, the child will not be speaking well, in the sense, it won't be in par with the other peers. But he's answering appropriately. Okay, in the sense, if you say, what did you have for breakfast? He can just say, I had bread omelette. So he may not even say I had, he might just say bread omelette. And the parents are okay with that because it's just communicating. But it may not be true, because age appropriateness to those syntactic skills may just not be present in the child. So that's why I said that you have to be taking care of syntax and morphology as well. Comprehension. See, many people think that children with learning disability have good IQ or above average IQ, so you don't have to work on their comprehension. No, it's not like that. Okay, these children do have good IQ, and they don't have comprehension deficits as you see in children with intellectual disability, as you see in children with slow learners. Okay, but they still have comprehension difficulties. And comprehension difficulties, how? They might have problem in understanding instructions. Okay, they might have a problem in listening comprehension. Okay, so when it is listening comprehension, the teacher is speaking in the class and the teacher is using a lot of sentences. The teacher is using a lot of words which are relational words. So grammatically related words, and that's where they might have problems in understanding. And a lot of times, all of this is also because they have a poor short-term verbal memory span. Okay, so when the sentence length is increased and they're supposed to relate the first word and the last word, it might be very difficult for them to relate. And most of the time, the meaning is carried in such target words, and they miss out the meaning, because of which they also lose out on their comprehension. So that's why I said the listening comprehension might be affected. The reading comprehension might be affected. See, now reading comprehension, many of us think that it's just more visual comprehension. But remember that as in how you're reading, you're actually correlating your visual with auditory comprehension, auditory part which is already represented in your brain. Okay, visual is something that you're doing online. But however, the auditory representations or the auditory traces, as I would call, like your PGC. Okay, so when you're reading, or your GPC when you're reading, so your grapheme is what you're reading, but you're already correlating it with the phoneme that you are already representing it in the brain. And then you're coming out with the spelling, or then you're coming out with comprehending that particular word. Okay, that's why I said listening comprehension and reading comprehension. Okay, so they can have a whole lot of deficits in comprehension, right from listening to reading comprehension. So what should the professionals do? First of all, ask very clear questions, okay, to the child, very specific questions. I think a lot of times the way we frame our questions and the answers we elicit is very different. There's no relation. We are too distant from the two of them. So be very clear what is it that you want to ask them. Give them a wait time. This is very important, because you're expecting some time. So if you actually see a lot of tests that we do with children with learning disability are not time-based tests, but we are still watching on the time that they're taking. Okay, except for maybe your rapid automatized naming tasks. I think most of the other things, you're giving them enough time to find out whether they're taking a lot of time or not. Okay, and you're going to record the time. So give wait time. A lot of critical thinking has to be taught, and the children has to be encouraged for questioning. That's very important, especially during therapy. Okay, see what happens when you ask, when the child is questioning you, is you get to know how the child is actually thinking. And it's important for an SLP or any other professional who's dealing with LD to know what kind of strategy is his mind working on. Okay, so if you're asking something, you're doing a task with a child, you're just saying, okay, now tell me if there is fire in the last floor, what would you do? Okay, and the child will answer to you. Okay, and the child will say, I would do this, I would do that. Okay, and then you have to ask the child in return, so why did you say like that? Why did you think that you could jump from the building? What if you got hurt? How would you go about that? Okay, and then the child is answering that. So the whole process is actually going to let you know that how the child is actually thinking. So just don't stop at a level wherein you're asking a question and he's answering. Find out why is he answering that. Okay, whether it is correct or wrong, that's not what we are really interested. You will always give a feedback to the child at the end of it, whether what he said was correct or wrong. But what is important for you to know is how the child is actually thinking about it. And the child questioning in return is definitely going to be a way that the child wants to know how you are thinking about it. Okay, so it's more of theory of mind is what I'm trying to say. Okay, so this theory of mind has a lot of applications in learning disability also. Okay, the therapist also should have a sound theory of mind, and the child also should have a sound theory of mind. So the more and more you encourage them to ask questioning, okay, or ask questions, you're actually encouraging them to think a lot. You're actually encouraging them to think what the other person is thinking. Encourage the student to elaborate a lot. Okay, elaboration is very, very, very important, because when you encourage children to elaborate, again, like I said, you will get to know whether they have an expanded vocabulary, do they have an expanded thinking, do they have a good metacognition. All of this is going to give you clues on that. So a lot of times treatment for reading difficulties focuses on functional treatment and a general remedial programs and so on. Okay, so we are interested to know whether, you know, these are the two broad things that should come in our mind always. Okay, so when we are treating children with problems, especially learning disabilities, it's more functional treatment. That's why I call it as functional treatment, because you're working more on the functions, you're working more on the processes. Okay, so if you remember in the beginning, I said that children with learning disabilities are the ones who have neurobiological processing issues. Okay, so it's not really to do, it may not really targeted at the anatomical part or the structural part of the brain, but it's the way the processes are actually functioning. Okay, because they have a deficit at that level, that's the reason we are calling it as functional treatment. And always remember, when we say functional treatment, we have this liberty to decide which functional process that you're going to work on. Okay, say for example, you know, I'm working on the reading process, I'm working on the writing process, I'm working on the phonological process, I'm working on the semantic process. Okay, I'm working on spatial orientation, I'm working on temporal process. Okay, spatial process, spatiotemporal process. So these are the processes that we are more interested in. Okay, we are not interested in trying to improve the area in the brain that probably has a deficit or does not have an obvious deficit in children with learning disabilities. Okay, so I will be talking about these, and I'll also be giving you out some general remedial programs. So yes, now very pertinent to India. Okay, now that's the reason I thought, since probably most of our audience are from India, the professionals are from India, I think it's very important for us to understand that it's not about just working on English or any other Indian language. Remember, we are not as simple as, you know, just learning English or just learning Kannada. There'll always be a cross-language transfer. Okay, and this is what I'm interested to put across to all of you, and this is what I think all of us should think about as SLPs. Okay, because you know, there is a child who comes to you, as a child has exposure to so many languages. How do you know that the other languages are not influencing the child's English? How do you know that English is not influencing the child's other languages? Okay, so that's why I said, and remember, when we take English and all our Indian languages, they are both in a very wide spectrum of difference. Okay, which means to say the system of the language itself is very different. You know, one of them, like your Kannada, is a more transparent language. Indian languages like Hindi and most of our Indian languages are more transparent languages, whereas English is more opaque. You know, which means to say that in Kannada or any other Indian language, mostly whatever we speak, okay, we write it like that. Okay, so there's a very good direct correlation between what we speak and what we write, except for a few sounds here and there. So very few sounds actually. Whereas English is not like that. You know, English has a lot of irregularities, and understanding that irregularities itself is a big processing issue. Okay, which all of us know that if we are not so proficient in English, how difficult we find to use English or to read and write English. Okay, so there have been a lot of studies that have been done, and definitely they have found that the processing itself is very different in different languages. And when it comes to a bilingual or a multilingual or a biliterate or a multiliterate, it is definitely an above issue for that. Okay, definitely can be very challenging. Okay, so like that, you will also see a lot of studies which have been done in languages like Chinese, which are more pictograms. Okay, they are not like symbols like the way we have it in English and Kannada. They are more, you know, just the symbols that we learn, abstract symbols. Whereas in Chinese, it's a little more easier for them to perceive because they're more pictograms. They're more closer to pictures, and they have a good correlation there. So imagine when a person with Chinese has to learn English, it can be a very difficult processing issue for them. Okay, so that's how, you know, the research is moving forward now. Okay, nobody is really interested to know what is happening in a child who's just learning English or just learning one particular language. Many of us are interested to know what's happening with cross-language transfer. Okay, how difficult or easy it is for us to diagnose a child with learning disability who's exposed to so many languages, and we have been a lot of times wrong in diagnosing itself. Okay, so remember, there are two things that I want to tell you here, though this is not the focus of our presentation. Since it's going with the flow, I'm just talking about it. There's something called as a central processing deficit. Okay, there's something called as a script dependent hypothesis, central processing hypothesis and script dependent hypothesis. Okay, when it comes to describing problems in dyslexia or learning disability. Okay, so here, what happens here is in central processing hypothesis, you'll see that despite whatever language a child with learning disability is, okay, he will have problems in all the languages. He will have processing issues in all the languages. This is the ideal condition for learning disability. But what does the script dependent hypothesis say? Script dependent hypothesis will tell you that a child with learning disability has problem in English, Kannada, Hindi, everywhere, but the degree of problem or the gradient of problem can vary in each of these languages. Okay, so it just doesn't mean that a child with dyslexia can be dyslexic in English but not dyslexic in Kannada. No, it is not possible like that. It can just be related to the proficiency of the language, okay, but not related to dyslexia. Okay, that's why I'm just trying to make it clear to you. So the central processing deficit hypothesis in dyslexia tells you that a child with dyslexia will have problems in all the languages. They'll have processing issues in all the languages. They will be below the norms in all the languages. Okay, but the script dependent will tell you that the gradient of problem can be different. That's all. That doesn't mean that they're dyslexia in one and they're not dyslexia in the other languages. I hope I was clear because it's a very important concept and I want a lot of you to take it forward this way. Okay, so do not think at all that when a teacher, when a parent brings a child to you, the parent will tell you that my child has problem in English, but he scores very well in Hindi. No, dyslexia cannot be like that. Okay, so if that is the problem, then it's not the SLPs who have to take care of them. Okay, they have to, you can send them to a special teacher. Okay, you can send them to special educator, get all the assessments done and find out. But trust me, this is not a child with dyslexia. That's what I'm just trying to tell you. They cannot be dyslexic in one language and not dyslexic in the other. Okay, and this is something that's coming up a lot in research, so I thought I should be telling you about this. Okay, now the belief is reading problems are caused by problems in various areas. So there are certain contemporary views and there are some recent views which are more at lab levels, which means they're still working on them. Okay, so what are the contemporary views that we have? And yes, keeping in mind the contemporary views and respecting all the research that's happening across the globe, I think we have also been working, picking up the right evidence-based approaches to intervention in LD. So the first and foremost, you will see that it's a strong belief that a child who has poor phonological processing, it can be either in terms of speed or accuracy, definitely has problems in reading and writing. Okay, so that's where a lot of them are working a lot using phonological awareness skills, phonic skills approaches, and all of that. That's wherein you see a lot of applications of that. Capacity limitations in learning disability, which is true. Okay, these are kids who have poor memory and poor attentional resources. Okay, so many times a child with the learning disability may not have attention issues as you would see in children with ADHD. Okay, it's not so bad that the child is not able to sit in one place and the child is just moving around and so on. That's the reason in the beginning I told you that earlier it was included under similar categories, but now they have very clearly bifurcated that. So you will see that these children with learning disabilities have problem when it specifically comes to reading and writing, specifically comes to understanding complex information, specifically comes when they have to understand complex instructions. Okay, so it's definitely much better than what you would see in ADHD. Okay, so that's why I said that they have poor memory or poor attention resources, and I think all of us know very well that these are the building blocks to learning anything. Okay, so if somebody does not have a good attention, the learning is going to be poor. If somebody does not have good memory, the learning is going to be poor. And that's the basic thing that you see is affected in children with learning disability. So you strongly have to work on improving these capacities or expanding their capacities, or if not expansion, at least give out strategies to them that they can use it appropriately in the situations whenever it is required. Okay, and that's why I said, you know, many times when you observe children with learning disability, the parents will also tell you that, you know, he pays so much attention when he's watching a movie. He can recall a movie very well. Okay, he knows the movie that he has watched like 3 years back, but he can't recall what he has to recall that was done in the school yesterday. What I taught him yesterday, he was not able to write in the exams today. Okay, so that's why I said they have poor attentional resources in certain areas. Okay, the other important point and a lot of evidences that we have found or collated is more with respect to vocabulary insufficiency, okay, which leads to a lot of language processing issues in these children. Okay, so that's why our core area is always to improve the vocabulary, to expand the vocabulary. I told you this earlier also, they have a very scanty semantic vocabulary. Okay, so we have to work on this. And when I say vocabulary, if I don't only mean the vocabulary related to semantics, but it's also to do with the markers that we have with respect to morphophonemic structures. Okay, so language processing is highly dependent on vocabulary, which we all know. Okay, the moment we improve somebody's vocabulary, you know that you're working a lot on their semantics, you're working a lot on their syntax, and that's how you know there's going to be a lot of improvement as well. Okay, so these are the areas that you have to remember. These are the contemporary views, but I would also like to put across what are the views that are happening more at lab levels. These are more recent views. So a lot of them believe that children with learning disability have perceptual learning issues. So that's how you will see a lot of eye tracking studies. So maybe at this point, I should also tell you that ISHA has an eye tracking laboratory. We call it as iLab, which was launched a couple of years back, and we've done a lot of research on that. Of course, it's still in its very infancy stage, I would call it. So we've had a couple of dissertations that have been done in dyslexia. So we are moving forward to work, use the lab for other clinical population like autism and so on. So what happens in perceptual learning is, you know, it has been seen that the way these children actually perceive when they're reading itself is erroneous. Okay, the way they're scanning paths, you know, we call them as scanning paths, that it moves, you know, when you're reading, your eye moves in a particular direction. So it has also been seen that, you know, these children actually have a very misdirectional reading. And that's another reason that they end up a lot in crowding issues. And because there are a lot of crowding issues, the perception of the letter or the text itself is affected. Okay, so I'm not going to go into the details of this, but yes, there's a lot of work that's happening. So maybe in some platform I will talk about it later on. But yes, there are a lot of them working at the, not just the visual level. The eye tracking that I spoke to you about was more at the visual level, but there have been a lot of things that are happening at the auditory level as well, auditory perceptual level as well. So that's how you might have heard about, you know, CAPD issues and working on APD issues in children with learning disabilities. Also, these children have a lot of poor sequential learning. Okay, that's called as a procedural deficit hypothesis. So children with learning disability have been theorized to have that problem because they have a very, high level procedural deficits. Okay, which means to say that, see, that's also the reason why their organizational abilities are affected. You know, they might do a task. Okay, all the more when they do a task, it is not organized, they don't follow the sequence, they don't know how they have to go about it, and that's why a lot of times the end result may not be as expected as, you know, like the other normal children would do. Okay, so this also gets reflected. So generally you will see that in their learning they have a general procedural deficit. Okay, so that also gets reflected in their academic skills. So these are the areas that are, you know, being researched, and they're still happening in different parts of the globe. Of course, like I mentioned, even at ISHA as well, in our labs, we've been doing a lot of these experiments. So what are we going to speak a lot about here is how the conventional therapy techniques can be used to improve the aspects that I just spoke about, like the phonological processing, vocabulary learning, and the capacity limitations. And what is it that's new, and does training really help dyslexics or learning disabilities? Okay, so that's what we are interested to know. Now, coming to phonological processing, so you might have heard a lot of synonymous words like, you know, phonological awareness, phonological processing skills, and so on in literature. Okay, so this is what exactly we are trying to mean. Okay, so you'll see that some of them also call it as metaphonological skills. Okay, they don't just call it as phonological awareness. So when I say phonological awareness, it's a huge area in itself, but it's a very important thing. Now, you know why we will be talking so much about phonological awareness, because it's more like a building block. You know, everything is dependent on phonology when it comes to language, right? And when phonological representations itself is affected, building vocabulary is also going to be affected. You'll see building syntax is going to be affected, and naturally when all of these are affected, ultimately the use of language is also going to be affected. So ultimately pragmatics is also going to be affected. So that's why I believe that working on the ground level with phonological skills is something very, very important and crucial. So we start off with pre-phonemic awareness skills. So before going on to syllable level, so what are these pre-phonemic awareness skills? So you have to actually first make sure the child knows the sound system of the language. Okay, so if the child does not know that the sound appears in the language itself, that's going to be very difficult. Okay, so you could have a lot of exercises to find out whether the child is aware of these sounds in a language. So this happens a lot of times as cross-language transfer gets affected. For example, there might be a lot of phonemes that are not available in Tamil, but they are available in Kannada, or they're available in English. So what happens is when a child has a background of Tamil, you will see that at times when the child is not proficient in both the languages equally well, you'll see that they tend to transfer from Tamil to English. Okay, so they'll start making errors there. It's quite possible, and a lot of times happens with voicing errors like that. Okay, so it's very, very important that you make them understand what are the sound systems of the languages. Okay, so that's why we call it as pre-phonemic awareness. So how do you do pre-phonemic awareness? So you can start off with counting the number of words, okay, and then move on gradually to counting the number of phonemes or the sounds of a particular language. Okay, say for example, you have a word like my name is Santa. So you want the child to just tell you, the child is not repeating that, the child is not producing that, the child just has to tell you where the bifurcation is, where is the word boundary, whether there's a boundary or not. So the child just has to tell you how many words are there. So either you can ask him to tap, okay, like for my one tap and name one tap and is one tap and Santa one tap, or the child is just going to say 4. Okay, so this is a very important part because this will tell you the word boundaries, and the child understands that there are group of phonemes that have made a meaningful word in that particular language. That's what is important. Okay, that understandability is important. So the next level is introducing rhyming words. Rhyming words is not simply a fun game. Remember that when a child is able to do rhyming, that means the child's sound system is so well categorized that it knows that this word end actually rhymes with this particular sound. So that means the child is able to group the words very well. So the phonemic representations are very good. So that's why we work a lot on rhyming awareness, okay, especially in emerging skills as part of emergent literacy skills. Okay, so like words like kill, bill, you just have to ask them, whether they sound very similar. Okay, and this is also fun to do with the children. They think that it's a game, but actually you're trying to check whether they're able to comprehend that there's a sound that is very similar at the end. They're able to group the sounds. So kill, bill, thin tool, best coat, shoe blue. So these are the words that you can just, I'm just giving a few examples, but you'll see that these are there in most of them. You have to work on them. Okay. Again, coming to picking up a word which actually rhymes. So this is more like a selection process. So there's a whole category, and from which category. So this is the next level of pre-phonemic awareness. So it's more to see how the child can best select. So what you are doing is you're not simply doing a task. Okay, you're actually giving him a lexicon. Okay, and you're helping them to pick up or select. This is more of a phonemic selection that you're going to do out of the phonological lexicon. So everybody knows, right? We have a phonological lexicon, we have a semantic lexicon, and then we also have an orthographic lexicon. So what happens here is when you are introducing a sound in a word, so if you actually see the words that I have put across are meaningful words, but it's also fun to do with non-meaningful words. Only thing is your semantic lexicon is not going to get activated. So if you have a word like train and you ask a child, which is the word that rhymes with train. So you have bus, rain, and bat. Okay, so rain is something that you're going to pick up, isn't it? So what is happening there? It is actually a phonological selection that the child is actually doing. Okay, so why didn't they pick the bus? Because it doesn't rhyme with train. Why didn't they pick up bat? Because it doesn't. That means they are out of the phonological categorical lexicon that the child is actually supposed to say when it has to say train and rain. Okay, so which means to say that it again knows the bifurcation. So remember, in our processing, it starts from input. Okay, so that's the basic processing model. Okay, we start from input, so that comes from the sensory information. So you hear that word, okay, and then you're just receiving that word. So the brain just receives the word, and at the next level, the brain actually analyzes the word, okay? And at the next level, the brain actually has to select that word, okay? And once the selection is made, either you store it or you use it for production, okay? So this is what I was saying. Selection is a very important part of what happens before production, okay? So when we say a child's, if just think that the child said bat instead of rain, okay, you as an SLP has to go back and realize that where at what level is the problem. Is it at the level of receiving the information itself? There's some problem with the child's hearing, okay, or next level is perception, okay, and the next level is whether the child is, find out how the child has analyzed. Why did the child say bat? Ask the child, why did you say bat? It will give you some reason. Then you will know that the child actually analyzed it wrongly. Okay, so maybe if the child has analyzed it correctly, the next level was maybe it didn't pick out from the appropriate lexicon. That's why the child produced it wrongly. I hope I was clear when I said that. Okay, so I'm just moving on to the next one. The next one could be activities like, can you find the odd one out? Okay, so you have something like bat, mat, sit. Okay, so the child should be able to say sit. Okay, so you're going to work on this. So remember, these are all not just, you know, activities for fun. That's why I'm telling you again and again, the more and more you introduce these things, the more and more the child gets experience to these things, the better their representations are happening. Okay, and you know, the better they're finding out strategies and the quicker they're able to recall these things. Okay, so when people are talking about memory, recall and things like that, there needs to be experience also before that. If you're not getting experienced or exposure to a certain set of things or certain set of words, you know, that is definitely going to affect your memory also. You know, that's why we do a lot of rehearsals also many times, isn't it? We do it again and again so that our representation is better and the recall is faster. Okay, so that's another reason that you want to do a host of activities. Okay, but you should know what is your goal. What is it that you are targeting at? Okay, that's the intention. So also you can move on to sentences, okay, that has rhyming words. So this is the next level. Okay, so this, because I told you this before also, you can't do this earlier. Why you can't do this earlier is you need to find out how their short-term verbal memory span is. So when you're doing it with words, you know that it is much easier because they don't require so much of a verbal memory span. Whereas when it comes to the, so you know, if you've achieved it at that word level, you can move on gradually to the sentence level and find out whether they're able to find out the rhymes at the sentence level. Okay, so the next one is producing the rhyme word. So if you see, till now I was only talking about perceiving them. Okay, perception. I was talking more about processing. I was talking about selection. But now this is about production. This is also very important. Okay, so rhyme production, are they able to do? So that's why I said, you know, from rhyme production, you can actually know where they're going wrong. And you can start working on those skills. So your strategies are going to be in such a way that you're going to help the child how to select from that word, how to analyze that word, how to perceive that. So perception, just think auditory discrimination itself is affected, then you know all of these skills are also going to be affected. Okay, so you are going to work on auditory discrimination first, because you know children with learning disability can have issues with auditory discrimination. Not all of them, but there could be a subgroup of children, and you have to trace back and find out where that problem actually happened. Is it at the level of discrimination, analysis, selection, or at the level of production? Okay, then you can move on to syllabification. Okay, so what is syllabification? Syllabification is just to see if the child understands that these syllables are a group of you know, sounds. So when you say papaya, so the child should be able to say, you know, give a tap of 3. Tapping is a very good way of trying to bring out boundaries. Okay, so all of you can just say, try that. You know, when there's a word like papaya and you just tap, go on tapping, you'll get 3 taps. When it's coconut, you'll get coconut. Okay, and when you say monkey, you'll get monkey. So that's a very easy way of you know, trying to find out the syllable boundaries. Okay, and this is actually very important because many times we kind of speculate the spellings, or we can make guesses about spellings based on the syllabification that we do. Okay, for our languages it's very easy, but when it comes to English, you can do that's one of the spelling strategies. You can actually draw a boundary, okay, as syllables and try to find out which are the sounds that are there in those syllables and in turn try to find out what are the graphemes associated with that phonemes. Ideally, that's the mechanism that happens whenever we are trying to, you know, spell out English words. You know, that the normal mechanism itself is like that. So you're just teaching that strategy to the child, because all the words cannot be learned just by rehearsal, or, you know, just by mug up, or just by taxing their memory. Okay, so you have to give them some strategies like this. Onset rhyme blending is another task that you want to do. Okay, so what happens here is you could just tell them that you are going to say two parts, and which you should put together to form a proper word. Okay, so suppose if you say s and un, they're supposed to say sun. Okay, so that's your onset, and your un is your rhyme. Okay, so it's not R-H-Y-M-E, it is R-I-M-E. Okay, so like that you have spoon. So you're kind of helping them to blend this. This is again a very important part of teaching them spelling. Okay, so if you actually see all these exercises that I'm doing for phonemic awareness, or the ones that I was suggesting to you, are all to actually improve their spelling. Okay, it's not merely sitting and writing down the spelling of a word 10 times or 100 times that's going to help the child do that. Okay, and not really a child with LD for sure. Okay, so you're just going on making him, because I told you this, they have a short memory span. So within the capacity of the memory that they have, if you can give them alternate strategies, that's when they are able to come out with some output, some good output. Okay, so just remember that taxing the memory is not the call of the hour for children with learning disability. Okay, so I hope you understood what I meant by onset rhyming. Okay, and then you have identification of the sound and the word that has been given, the sound that has been given and the sound that they've heard. So you kind of have to ask them to recognize that, you know. So you tell them, now tell me the sound that you hear is k. So which are these pictures which are actually coming out with that sound k? So you give out sleep, so you're giving pictures. This is much more correlatable, so that's why we use a lot of pictures with them, because they just, you know, can reduce their limited capacity of verbal span. That's why we are using pictures also along with them, so that we are giving them an extra redundant cue. So you give a picture of sleep, cat, and clock. So the child is supposed to be indicating or pointing out to the cat and the clock, because it has the sound k. Okay, so that's something that you can always do. Then you can have onset rhyme segmenting. Okay, so if you have something like spoon, okay, you should ask the child to bifurcate that and say how you can separate the two of them. Okay, so it is going to be s and poon. Okay, spill, s and pill. Okay, so you can have activities for all of them. Then you can have phoneme blending, I think, which is the easiest for the child, but it is not so easy for a child with learning disability. Okay, so but this has to be part of your program, like o t. Okay, so they're supposed to say float. Okay, so like that you can design something like that according to your you know, however what language you are dealing with, you can go according to that. Then you have syllabification, which I told you, a very important part of it. So you should be able to, so all this while earlier the child would just say that it contains two sounds, or they would just tap. Okay, so now you want the child to also produce that, you know, segment that and then produce the syllabus. Chopping the sounds, okay, is something that you want to do. I think it is self-explanatory. So when you say ka, k, a, r, this is also something that you have to do. It does give you a lot of clue for trying to know whether the child is able to perceive the phonemes of that particular word. So you could also have phoneme deletion activities. So remember, actually, these are all, you know, levels at different cognitive levels. Okay, so each one of them are different activities. Each one of them are going to represent in the brain in different ways, but they're all going to be done in a hierarchy. Okay, that's what is important. So when you say phoneme deletion, so if you say school, and if the child has to remove, if you remove, okay, and then you have to ask the child what remains. Okay, so they have to say cool. So what are you getting as a professional from this? You're trying to understand that, okay, now the sound systems are just fine in the child. So that's why the child is able to bifurcate and say this. Okay, so you can move on like that with consonant blends, and you can move on to digraphs. Okay, so depending on the language that you're going to do, you can work on short vowels, You can work on long vowels. You can also use non-words. Okay, once you do words, you can also move on to non-words. Okay, so that's how you're going to work completely on phonological processing. So the next part that I'm going to put across is the vocabulary building. Okay, so we call it as context-derived vocabulary building. That's what we are interested in. We're not simply building a vocabulary, that we are doing it for the other communication disorders. So this is something much more higher that we're going to do for children with learning disabilities. So why teach vocabulary building strategies to these children? Okay, so you see that the boy who is the topper is very smart. His nature is very good. So this illustration will help you understand this. Okay, the boy who is the topper is very smart. His nature is very good. He helps all with their work. Because of this nature, everybody loves him. Okay, so now if you actually see the ultimate in understanding of, you know, the whole gist of this thing is, you know, why do you think everybody loved this boy? Okay, but to derive at that, you know, you had so many things happening before, and so many vocabulary that was happening before. So that's why it is called as context-derived vocabulary building. Okay, it's because you're creating a context, and within that context, are they using the right vocabulary? Okay, so you had so many things in this, right? You had, you know, you're, of course, we were talking about the boy, so the boy is the vocabulary topper. Okay, and that's why he was smart. Okay, nature was good. Okay, and he helped everybody with work. So these are the context derived vocabulary. If you actually see, these are the keywords in the text. Okay, these are the keywords in the text which actually helped us understand why the boy was loved by everybody. Okay, so that's why we call it as context derived vocabulary, because the other vocabulary is something that these children can have. You know, they probably have a much better vocabulary than what you see in the other conditions with communication disorders. But using that vocabulary in the context to understand the text, okay, or to understand a passage is something that you see is lacking in children with learning disability. That is why we call it as working on context derived vocabulary building. Okay, so you could have a lot of flexibility with multiple meanings. You can use a lot of words. You can use a lot of homophones, a lot of homonyms. Okay, I'm just going to give you one example. So if you have something like Prasad dash his son to go out. Okay, so the choices that are given is allowed and allowed. You know, actually you're saying it the same way, but now the child should be able to fix up the word, the word with the spelling ALLOWED. Now this is what is something that you're going to strengthen. So in this context, this is the word that's going to fit. That's how you're going to teach them. So in isolation, you know that they know the meaning of allowed, ALLOWED. They know the meaning of ALOUD. But within the context derived vocabulary, that's what you're going to be teaching them. Okay. So in this way, this is how it is going to come. So like that, you can also use homographs. Okay, so for example, if they said he said that he's close to Sindhu. Okay, now close is something that you can use in different contexts. Okay, but to derive at this context, you're using this word close, and all of us understood that when you say that he's close to Sindhu, that means they might be very good friends, and you know they know each other very well, and so on. Okay, so that's how you have to teach them. You should teach them that, you know, because of this word, and because this word can mean so many different things, but because it fits very well into the context because of the vocabulary in that particular sentence, that's why the meaning of the sentence is like this. Okay, this is how you're going to teach them stepwise. Okay, that's what is important. The other aspect is bootstrapping. Bootstrapping, I think we use in a lot of children with communication disorders as well. We use it with SLI also. So you can ask the child to construct both the directions of the verb and ask them to keep it in mind, the forms of the word that it could take. Okay, so you have an example here, something like, you know, you have kill. So you have she killed him. So this is more like a transitive verb. And then you can also introduce agents and directions. Okay, you can also introduce a lot of, agents, whether you have two agents or only one agent, or you could also have associations with what is pain and how it is, how pain is unpleasant and so on. So I'm sure a lot of you must have learned about it in your bootstrapping mechanisms. You know, there are different kinds of bootstrapping mechanisms. Okay, so basically bootstrapping mechanisms is a method wherein you're giving out some kind of a cognitive strategies in language for a better understandability. Okay, so like that you could have prosodic bootstrapping also. Okay, so what happens in prosodic bootstrapping? The way the intonation, the way it is said, the tone with which it is said, the stress with which it is said, you understand the sentence. That's your prosodic bootstrapping. And this can also help a lot of children with learning disability also. So I would always suggest the young clinicians to use a very, natural prosody with the child when they're talking during the sessions, because they actually are bootstrapped. They understand the information because of a prosodic bootstrapping. Okay, like that you can have semantic bootstrapping. Okay, so semantic bootstrapping, like I already mentioned, it's more to do with the meaningfulness, the vocabulary that's being used. So semantic bootstrapping is also another strategy that we use to make them understand a particular word. Like that you could also have syntactic bootstrapping. Okay, the way the grammatical relations are connected with each other, we understand the information. Now, why it is called bootstrapping mechanism is, remember, all this while we thought a normal child just learns it naturally and understands it, but a child with LD has to be taught how to understand that sentence. And that's why I always refer to as more bootstrapping mechanism. So you have different activities here that you could use for bootstrapping mechanisms. So you can just ask the child to pick at least one word from the phrase. So you could have, like he laughed, okay, in pain. Okay, so you can just, figure out how, what, kind of best fits here. Okay, so you can actually see that it's more like a match the following kind of a thing, and you can see how well what fits in which context. So that's the bootstrapping mechanism that you're going to use for context derived vocabulary building. So does training really work for children with learning disability? There have been a lot of behavioral evidences. There have been a lot of imaging evidences. Okay, so it does to some extent. That's what we should believe in. Okay, so this was one of the studies that I did along with my student who was a part of the dissertation. So you can actually see how it varied across different skills. Okay, so we did use a lot of these bootstrapping strategies for these children with learning disability. So the blue graph is actually talking about the baseline, and the red one is more to do with the post therapy, and the others are all across the skills. Okay, it was a very short, very initial study that we did. So if you actually see here, in some you see that there's not much of a difference. Okay, but in a lot of other areas there's a large difference. Okay, so it's just it just goes to say that, yeah, somewhere the bootstrapping strategies is helping children with learning disability, and it is definitely helping certain areas of reading and writing skills. Okay, so this was again another study that was done by Gabrielli in 2009 for typical readers and the others with dyslexia before treatment and after treatment. So they were trained on phonological awareness skills, and of course they have had their own behavioral findings also to this. So if you actually see that the areas, this is what you see in typical readers. See, the networking is a little different in children with dyslexia. That's what we should see. Many times the networking is very scanty. That's how I would call them in children with dyslexia. Whereas a normal reader uses a lot of strategies but comes out with the right output. Okay, so the network is a little complex in normal readers, whereas in children with dyslexia, they're more isolated and they're more scanty. That's how I would call them. So if you actually see, once they were trained and once they were, when they measured after the treatment, the kind of maps that you are seeing are quite similar, to typical readers and dyslexics after treatment. So this is just picked up from Gabrielli studies directly. Okay, so it just Gabrielli made an attempt to actually try and find out how cortical rewiring is taking place. So this is what I'm interested in telling you. Okay, so what you as SLPs are doing is actually trying to do a cortical rewiring. Okay, so you know that these children have this period of critical development, isn't it? So whatever you're working, there's a lot of rewiring that actually happens in the critical period. And that's what is important, because this rewiring is not so effective, or this rewiring is not happening to a very large extent after the critical period. So that's why you don't see much improvement when children come to you at a later stage. That's why we keep telling the parents that you should bring them as early as possible. Okay, that's because the brain is still plastic. Okay, the brain is ready to take a lot of changes. The brain is able to kind of reorganize itself with whatever stimulation that you are giving. Okay, and that's what is that's what you as a professional is going to do. And don't think that your work is, you know, as short as, you know, any other professionals. Okay, so I just found that we are running short of time. So yeah, so I'm just going to finish this. Do you want me to switch off the camera? Okay, I hope that's fine. Okay, so these are some of the evidences that I wanted to put across to you. Yes, there's been a lot of things that have happened, and with Gabrielli studies, I'm just leaving out the reference for you. That's the main thing that I wanted to put across. Magnocellular dorsal deficit theories and procedural memory deficit theories are something that are happening in the current period also. So I would like all of you to have a brief look at this diagram. This is more to do with the magnocellular theory. You will find it in the literature, but there's a lot more that's happening there. It looks complicated, but all those who are interested in research, I would recommend them to go and read these articles and you know, get more knowledge on that. I did talk a lot about perceptual learning approach when I was telling you about eye tracking. So this is something that I'm not going to be dealing much, because I think we are running short of time. Okay, so if there are, I'm just going to run quickly through my slides, but I'm going to leave out these slides for you because a lot of these things were discussed in what I told you earlier, like your visual word crowding and so on. And the basic things that I wanted to cover, I think I have covered it, right from, you know, when I said phonological processing skills, working on, you know, context derived vocabulary, and majorly the roles of SLPs comes there. Okay, there's a lot more that you can do at the level of central auditory processing disorders. Okay, so maybe that is something that I want to highlight a lot. I'm leaving out this syntactic bootstrapping. All of this was done for you. So I'll just quickly move on to the CAPD strategies. Okay, CAPD is something that we as speech and hearing professionals should be doing. Okay, and these are done at different levels, like at the cognitive level, metacognitive strategies level, and the linguistic and metalinguistic resources level. So you have something called as bottom-up treatment strategies and top-down treatment strategies. If you actually look out for books, Talal's books, if you look out for Music and Shermak's books, I'm sure a lot of audiologists also, you know, they're like Bibles for CAPD. So I would recommend the SLPs also to look out for these books, because they give you very, very good evidences to say that how, you know, both bottom up as well as top down strategies have to be worked. So I think now, since specialization has happened into SLP and audiologists, now there needs to be a mix, there needs to be an interdisciplinary happening at that level also. Okay, so often I would always say that bottom-up treatment strategies is usually taken care of the audiologists. They work a lot on that, on bottom-up strategies, but it's the SLPs who take care of the top-down management strategies. But I think it should happen as in a team. Okay, so both, because you cannot find children just with always a bottom-up problem or just with a top-down problem. So it should be more like a combination of the two of them. So your bottom-up treatment strategies are those which work more on increasing their clarity of signal, their perception, you know, trying to work more on their auditory training, listening training, I would say, in CAPD children. Your top-down will focus more on the language aspects and the cognitive language aspects, not just the language aspects. I would call it as cognitive language aspects. So when I spoke to you about phonological strategies, you know, I told you about phonological processing, I told you about context-derived vocabulary. All of these form your central resources. Okay, these are all your top-down processing strategies. You're working on your semantics, you're working on your syntax, you're working on pragmatics in children with learning disability, context use. All of these are nothing but part of your top-down management strategies. Okay, so that's what I wanted to tell all of you. A team approach is very, very important. Okay, so let us all be working as in a team and not in isolation. This is my strong viewpoint, that especially when it comes to learning disability, you need to work with them as in a team, and not really like in isolation, as you know, just the SLPs or the audiologists or the speech and hearing professional can take care of that. Please respect the other professionals, have an interdisciplinary approach. I think you can do great in improving the quality of life of persons with learning disability. Thank you so much. And I would now take a few questions. I know we are running short of time. So yeah, over to the moderator. Yeah.
Thank you, ma'am, for such an informative session. You have given us such good information about so many things, like a clear line between when to work, when the work should be done by an SLP and when the work should be done by a special educator, and so many differential points for the differential diagnosis between learning disability and CAPD, and so many good things, and what areas should be focused when working with an LD child, like what should be the activities for pre-phonemic awareness skills and phonemic level, what should be the activities, and what way should we work, and how they are getting benefit from our therapy, and how can we work on vocabulary building. All things were very good. I think these are our takeaway messages which we all have learned today. Now, we also have a very long list of questions. As you know, that this is question answer time. So now over to Ms. Tanya.
Good afternoon, everyone. Now let's start the question and answer session. So the first question is, how does the phonological awareness play a crucial role in academic success of a child?
Can you please repeat the question?
Yes, ma'am. Ma'am, it is, how does the phonological awareness play a crucial role in the academic success of a child?
Yeah, so I think I was just talking a lot about it. Your phonological processing or phonological awareness, that was the crux of my presentation actually. Okay, so when you say academic success is the output that you're actually seeing, isn't it? So is academic success governed by so many other things? Like, is it reading and writing that you're talking about, or is it the motivational aspect of the child? Okay, so if you're technically talking about it as in, whether the child is reading or writing appropriately, then definitely you're going to be working on the spelling skills. Okay, if it is a spelling skills, then definitely you're going to be working on the phonological processing skills. So your phonological processing skills are more at the as the building blocks for your reading skills. I would not call it as academic success, because there's so many other things that you have to do beyond that. Phonological processing is just one aspect that you're going to work to improve their spelling skills, in turn improve their reading fluency, reading comprehension, and ultimately their reading output. Okay, I hope I was able to answer that. Do we have
Yes,
any
ma'am.
other question? Yeah.
Yes, ma'am. Ma'am, the next question is CAPD always associated with poor listening comprehension?
Yes, that's such a wonderful question. Seriously, you know why I said that? Because when you say auditory processing, or when you call it as central auditory processing, I was just talking to you about it. You have the bottom up and the top down processing strategies, right? So when it comes to bottom up, it includes all of your things like, phoneme perception, your discrimination, your identification, recognition, all of that. Okay, so if you know that this is affected, definitely at a higher level, when the information has to be processed, it is going to be affected. And when you know that a child is not able to comprehend word because he has not really perceived the sounds, then naturally the meaning is going to be affected, and ultimately the overall listening comprehension is definitely going to be affected. Okay, so you have to find out at what level this problem is. Sometimes it may not be the level of perception. Okay, it might be at a higher level. No matter what, if you have CAPD, definitely listening comprehension is going to be affected.
Thank you, ma'am. Ma'am, the next question is, how do I assess the child's vocabulary just with a general conversation? Are there any specific tasks?
There are tests. There are actually tests, picture vocabulary. There are various picture vocabulary tests. So it's always recommended that you use a picture vocabulary test, okay, to find out the capacity of a child's vocabulary. But yes, otherwise also I think you can give a very informal have an informal conversation with the child and give a particular topic to the child, ask the child to talk about it, and enlist the number of words that the child has. Okay, but remember what happens there is you should know the norm. If you don't know the norm as an SLP, okay, say for example, if there is a child who's 8 years old who comes to you, okay, and you don't have the norms for vocabulary of that child, and now how are you going to say whether a child with learning disability has a limited vocabulary? So you should have a sound knowledge of the norm for vocabulary development even when you're using an informal assessment. You could still do it if you have a good knowledge of it, but otherwise I would recommend you to have vocabulary tests that can be used for assessing vocabulary. Yeah.
Ma'am, there is a long list of questions, but as we are a little running short of time, I am heading towards the last question. So this is, how do I differentiate between CAPD and learning disability?
I don't think you should differentiate, first of all, okay? Because when I said in the initial portion itself, I said learning disability is a huge, big term, and it has a heterogeneous group of disorders, okay? So CAPD, have children having learning disability could just be a subgroup, okay? So a child with CAPD is definitely going to have learning problems, but a child with learning disability need not have CAPD. That's what I meant. Okay, so learning disability is a bigger, wider term. CAPD is one such problems under that, but you have to rule out, as a professional, you have to rule out whether the child has CAPD or not, because then you know what is the direction that you can move on for management. But trust me, not all children with learning disability will have CAPD. It's only a subgroup. Okay. Yeah.
Thank you, ma'am. Good afternoon and happy Teachers' Day to Dr. Jayashree, ma'am. Thank you for putting up a beautiful and useful presentation. We shall seek your guidance on telepractice related projects of ISHA. You are an inspiration to students and other teachers alike. You have activated a hunger for knowledge and wisdom, inspiring us to work better for learning disability and become a better therapist. Thanks a lot, ma'am. I would like to take an opportunity to thank all the founder members of ISHA who have always worked hard for the upliftment of skills and knowledge of all the ASLPs. I would like to take a moment to thank all the present elected members of ISHA. Thanks for being an exemplary team. I feel honored as I get to associate myself with you creative people. You all are working endlessly towards the upgradation of our field. I also feel privileged to thank the head of ISHA Educational and Scientific Research Committee, Ms. Kalyani ma'am, the moderator, Ms. Mona Chug ma'am, and the coordinator, Ms. Tanya, who all are consistently working towards promoting learning in the ASLP community. I would also like to extend my gratitude towards the ISHA team members, the professionals, and the student volunteers who are working behind the scenes. I would like to thank all the EC members of ISHA for providing e-certificates to the participants. I thank Ms. Amulya Rao, coordinator of ISHA, for helping us through the management of the webinar. Last but not the least, I would like to thank all the participants for finding time out of your busy schedules to sit through this lecture that demonstrates your unwavering commitment to our cause. We are most grateful. Also, I would like to tell all the participants to come and join the upcoming webinar organized by ISHA. Also, ISHA will provide the feedback form on the registered mail IDs of the participants who have attended the entire session. I request the participants to fill the feedback form and revert back at the earliest to get the e-certificates. Happy Teachers' Day to all the teachers and gurus. Thank you so much, everyone.
Yeah, I'd just like to give a last word of thanks from my side. Thank you so much. I think it's a great honor for me to be doing this work on Teachers' Day. So wish you all a very happy Teachers' Day. And to all my teachers who I would remember on this day, I think you've given me the best live teaching, not just speech and hearing. So my biggest acknowledgements to all of them. And thank you once again, Disha, for giving me this opportunity. Thank you, one and all.
Thank you so much, ma'am.
Yeah. So can I end the call?
Yes, ma'am.
Yeah. Thank you.
Thank you so much, ma'am.